So let's go through the nose symptoms. You said sneezing. Is there a certain picture that you think of when you see somebody rubbing their nose? Why are they rubbing their nose?
Well, usually they're rubbing their nose because it's itching. And then, of course, you get that drainage out of the front of the nose, and so that's embarrassing, so you're trying to swipe that away.
When you sneeze, is it just once or twice and sneeze 4 or 5 times
Oh,
a day?
some people can sneeze all day long, it seems, several times in a row.
It's very, very difficult on somebody when they're sneezing. You mentioned fatigue.
Sure.
Why do people get fatigue if they've got runny, itchy nose?
Well, when you think about that, you're not sleeping well typically. So at night, that runny, itchy nose can turn into drainage down the back of the throat because you're lying flat. That can lead to a cough, and if you're not sleeping well, you're not performing very well the next day.
How about the eyes?
Itchy, watery, red.
The same allergic reaction occurs in the eyes that occurs in the nose?
Typical, yes, same thing.
You get itching of the roof of the mouth?
Absolutely, and in the back of the throat even.
So it just makes the person absolutely miserable. What about school performance or
Yes.
work performance or work days lost? What happens?
Right, so if you have a child that's not sleeping well at night, you have a parent that's not sleeping well at night, and then neither are performing well the next day. A child who doesn't get the proper sleep can't concentrate in school and focus on what the teacher's telling them. Same thing in the workplace. If you're not sleeping at night, you're probably snoozing in the daytime at work.
So the symptoms that somebody has, if they've got a stuffy nose and they've got congestion, do they complain more of itchy, sneezy, or my nose is just blocked up and I can't breathe?
Right. Well, patients can certainly experience all of those, but I have found in my patients that the congestion is more bothersome. It's more difficult to treat and tends to be a little more bothersome for the patient.
So if the nose swells, gets all congested, can it cause other problems in the ears or the sinuses?
Absolutely. It can cause improper drainage of the sinuses and the ears. That can lead to sinus infections and ear infections.
So it's a real big mess that we have.
Absolutely. One thing leads to another, you know.
When we think of spring allergies, we've talked about tree pollen and grass pollen, and we've talked about the nose, and we've talked about the eyes. Do the lungs, are they involved in allergies too?
Absolutely. There's a hypothesis called the one airway hypothesis.
One airway, that would mean starting where and ending?
Starting in the nose and mouth and ending down in the lungs.
And so you can have the same allergic reaction in the lungs. What symptoms?
That's right. The same mediators that bother the upper airway bother the lower airway as well. Coughing, wheezing, tightness in the chest, shortness of breath, those can all be signs of allergies of the lungs.